Good afternoon, everyone. On behalf of the Maynard Institute co-directors, Evelyn Sue and Martin Reynolds and staff, welcome to our Best Practices series that explores COVID-19 coverage and its intersection with the Maynard Fault Lines framework. I am Felecia Henderson, Table Stakes Coordinator for the Maynard Institute. I'm a longtime Detroit journalist who's worked in numerous editing roles at the Detroit News and Detroit Free Press, the last being on the senior management team at the Detroit News. I'm proud to say I'm a 1987 graduate of the Maynard Institute's editing program, which gave me the leg up to become an editor. So today we're looking at coverage through Maynard's Fault Lines lens directed at class. And for those of you who may be unfamiliar with the framework, here's a quick summary. Robert C. Maynard, the country's first Black executive editor and newspaper owner of the Oakland Tribune, founded the Institute along with his wife and several others in the late 70s. He was inspired to create the fault lines following the 1989 earthquake that devastated the Bay Area, particularly the Oakland area. The framework reveals that societal fault lines of race, class, gender, sexual orientation, geography, and generation crisscross the United States, much like geological fault lines. Joining us for our discussion on the fault line of class is Louis Aguilar, senior reporter for BridgeDetroit, a new nonprofit news site, which is an investigative arm of the independent, nonpartisan Michigan news organization, Bridge Magazine. Louis and I have known each other since 2004, when he joined the Detroit News as a business reporter and later becoming an investigative reporter. He joined BridgeDetroit last month. He's an award-winning journalist and a member of Investigative Reporters and Editors, as well as the National Association of Hispanic Journalists, formerly served on the NAHJ board. So this will be a conversation about coverage, but by all means, we want to hear from you. So if you have questions, please post them in the chat section and in the chat section below. And we ask everyone to please stay muted. So Louis, let's get started.
Hello, everyone.
As a native Detroiter, you and many of your colleagues at Bridge Magazine have worked in Detroit for a number of years and are very familiar with the city's demographics. How did you and your team prepare for coverage? And were you all surprised that Detroit became a hotspot for coronavirus?
Well, thank you for that. Yeah, I do. I am very lucky to work with a lot of experienced people who've been in the Detroit market. I think what it told us, our instincts told us that if there was early data to show that Detroit was becoming a hot spot, it was going to go, I think there was a suspicion, an awareness that perhaps it was going to expose the long health disparities and income disparities that Detroit Black population has to deal with. And so I think we were the first publication to really sort of look at the state data of the cases. And once we sort of determined that Detroit was a hot spot in terms of just the percentage of growth, we then started to look at other areas in the state where there was also cases. And what we found was that most of the places that were having a surge in numbers early were also cities, essentially, where there were large African-American communities, not just Detroit, but Southfield and Oakland County, Flint, and another part of the state. And so we were able to sort of make that connection that it is hitting harder about African-American communities. I know this is more about class, but I mean, as often is the case, class and race are so intertwined. It did inform what we should be looking for.
Yeah. Detroit is the county seat of Wayne County, And Detroit is on the border of one of the richest cluster of cities in the country, the Grosse Points.
Right.
How do you see class issues in Detroit, and how do they compare with what's happening in other Wayne County communities like the Grosse Points and Livonia and other communities in Wayne County?
You know, I haven't seen in Metro Detroit, I haven't seen a huge pushback among other communities that are like Grosse Pointe or any other community, because I mean, just the surge in cases was so quick in Detroit and in the region, and it wasn't like Oakland County, the affluent county, was immune. I mean, they were having a large number of cases as well. So I did not see that usual suburban versus city argument you often see in Detroit that comes down to class and race. I mean, you certainly saw it in other parts of the state. I mean, was it last week? I mean, it was national news when there was just a huge outpouring of protesters in the state capitol, and a lot of those people were from more rural parts of the state and other parts beyond Metro Detroit where there's a lower number of cases.
Can you talk about, because you just mentioned something that the rise was so fast in Detroit and really just southeast Michigan of those counties, Wayne, Oakland, and Macomb County. Can you talk about what those factors, what you saw leading to the spread so quickly? Is it close?
No, that has been certainly a nonstop discussion among all of us, and I'm sure every newsroom is having it, of what we can say that is accurate without being overreaching in terms of the numbers show that it is clearly hitting the African American community deeper and harder. I mean, and also, you know, I just knowing people, I mean, within 3 weeks, I was talking to Detroiters, particularly African American residents, who had known 10, 12 people who had already passed away. It was just numbing and shocking and heartbreaking. So, I mean, it's always been a delicate balance to point out sort of the root causes of lack of healthcare, of underlying health, you know, things like obesity and diabetes and things like that. And it's good to point that out. Now there's more information about nursing homes, but the truth is, I mean, it was even more subtle within the Black community of, especially Detroit, but probably other regions, where it hit a lot of middle-class African Americans. The woman I was telling you about earlier, who knew 12 people who had died. It's hard to even say that, but she said they were all middle class. She's a middle class person. The one was you know, a police officer, another was an attorney, another was a well-known entrepreneur. You know, so it just showed the sort of interconnectedness, I think, among Detroit's close-knit African American community. So it's been a hard balance to write all of that with some amount of sensitivity, and I hope we get it right.
Right. You know, it's been widely reported by numerous news organizations that 40% of Michiganians who have died have been African American, while they only make up 14% of the state's population. A similar picture you've reported is emerging in other cities, but talk a bit about the unknown factors you've written about that's making up 25% of overall deaths. What are those unknown factors?
Well, yeah, I mean, to give an example, I mean, we're still, about 2 weeks ago, the city began to sort of give sort of zip code information, sort of a map of areas hardest hit. And we are being careful of what that really shows. I think this kind of answers probably like how careful we're trying to do this in a real time, because we don't want to oversweep to show that this neighbor, there's too many unknowns. I mean, in terms of raw data that's coming at us every day. There's a zip code in Northwest Detroit, and it shows it's one of the hot spots of the city in terms of the number of cases. But it also is a place where there are a number of nursing homes. And it's also a case where the city simply says, we've tested heavily in that neighborhood. And so it's hard to come to a conclusion with all this data coming at us so quickly. And so it's an ongoing conversation of how much we can say with what kind of conclusions we can make, because it's a tough thing to deal with.
It's one of
I
the,
don't know if that answered your question, but.
well, I was just wondering, is one of the unknown factors the fact that people aren't required to list race, because there's been some question of, are these numbers accurate?
Sure, that's one of the things. Yeah, we've talked about that. I mean, I think state data shows there are like 20% of the people who don't put down race, so we have to be careful about that. But it's still, and overall, we were confident enough, and now officials have said it, that, I mean, the African American community is being hit much harder than other communities.
Mm-hmm.
So, and you can, I mean, we always sort of go to root causes. I mean, Detroit's one of the poorest cities in the United States. The density of the African American community is actually quite higher than most places in the United States. And so there's a lot of segregation.
It's true. And now that we're seeing that the deaths of disproportionate number of African Americans are spreading throughout the state of Michigan, can you talk about how COVID-19 is impacting the Latino population in Detroit and in Michigan as well?
Well, that's a good mystery, because it's low. The percentage is really low. And one, I think, might be just age of Metro Detroit, and also probably nationally. I mean, the average age of the median age of the Latino population here is like 24, and the median age of the African American community is probably around 37. Okay. And for the white community, it's like 35. So simply much younger people, I think, who statistically can overcome risk. But I also tend to think, as traditionally in Latino community, especially among immigrant Spanish-speaking community, I just don't think they're being counted. I think there's obviously a reticence to come forward and be recognized.
Okay, good. As I expected, the questions are rolling in quick and fast, right? One of our first questions is, why has no one really focused on investigating the reason and result of us having a national test, as well as and tracking program? I started hearing some of that today, but what are you hearing in regards of national testing and tracking?
Oh, the way we cover it is really just through state governor's reaction. I mean, our governor is having a moment, literally a Saturday Night Live moment, because she is having a high-profile fight with our president over these kind of issues. And so we hear we're covering it from the urging of local officials who clamor for more testing, for more resources, who try to explain the issue of we are ramping up for testing, but the resources aren't there, and we could use more federal help. So that's the way we've been covering it mainly.
Okay. I think you addressed this earlier, but another question is, how can we make sure coverage doesn't blame victims and their families when systemic inequalities have existed before the pandemic? Sure.
No, believe me, we have that conversation all the time. I mean, it is a delicate situation to report the numbers and try to put it in context of the underlying health issues of the African American community. I hope we're doing a good job. I mean, other than have conversations with your reporters and editors to make sure we have this in context, it is something we think about and try to do with as much intelligence as we can. And I hope we're doing okay. But yeah, you're right. I mean, the narrative got a couple of weeks ago, the narrative got a little too hardened by the national media, which tends to happen when you are on the local level and you sort of break this trend. And then when it gets to the national level, it really just become poor Black people in Detroit. And it caused pushback among some in Detroit, including the mayor, who pointed out, you know, there were affluent communities in New York City and Massachusetts who also have large outbreaks, and you're not seeing reporters descend on them. And that's true. I mean, Detroit always becomes sort of the example of how bad it could get, essentially.
We have a question from Raj and Maynard 200 alumni. What is the population density in Detroit per square mile?
I don't know, other than the fact that I know that it's an odd city in terms of there's lots of empty space. I think at one point there were 70,000 empty buildings. And yet, in terms of, there was still much urban density of where people actually live. So if you can figure that one out, good luck. But so it's a very odd city in which there's lots of empty spaces, but in terms of the number of people, it is very dense.
Okay. In your reporting, you reported nearly 1 in 4 of the 4.76 million employed people in the state have filed for unemployment. 1.2 million jobs will be lost. Is there any data, early data, that's showing what sectors of the workforce of people are filing for unemployment? Who are now the vulnerable populations?
Every sector is a point for, I mean, the manufacturing, the people who worked in retail and bars and restaurants, teachers, you know, construction workers. I mean, literally every sector is filing for unemployment. When you have those kind of numbers, it means it is depression-like numbers. You know, it is across the board. I mean, white collar professionals, the whole deal. In terms of the breakdown, I don't know, but clearly it's all across the board.
Okay. In one of your other stories, looking at the food issue, you know, now there are 3,000 sites across the state where residents can get food, but food is running out. Again, you know, do you have a demographic sense of the people who are in those food lines, and what is the plan to beef, not really wanting to say to beefing up those food lines, but how to stock enough food that everyone can receive supplies?
Yeah, that is a brutal sign of the economic toll that it's having on a widespread amount of people. You're right, there are 3,000 emergencies set up for free groceries, essentially. And food banks across the state say that demand is essentially up around 41%. And that really means about tens of thousands of new people are literally in their cars waiting to get free groceries. Like, really, I was there just 2 weeks ago. I mean, I saw a line 6 blocks long to get a bag of potatoes, you know, some tuna, some spaghetti, a jar of peanut butter, a gallon of milk. And there were so many cars that they had to turn about a dozen away because they ran out of food. So it does speak to, I think, just the underlying economic fragility of many people who were living paycheck to paycheck. You know, I talked to several people in that line when I went to that food bank 2 weeks ago, last week. And, you know, I met a young man who was a bartender and a waiter but all of that went away a month ago. And he said he had $18 left in his bank account. And I mean, he was waiting for the IRS payment and his unemployment to kick in. But still, I mean, things like credit card debt, car loans, student loans, rent is a heavy thing to do. And so it does really show the fragility of many people who are lower middle class. I've met other people whose income is really just, is one person working in the house compared to three. So they're relying on less than half the income. So yeah, but you're right in terms of there are many examples where those food banks are running out of food for the day, and it speaks to a couple of things. One, the amount of donations they get from grocery stores is plummeting because there is a run on groceries by consumers, and so there's less to give to food banks. But it also does speak to the logistics of getting food in time to places, whether it's food banks or grocery stores. I mean, there's just a run on things. There's there's supply chain issues in terms of meat, as I think we're all probably starting to read of in terms of meat packing facilities are closing down, and so there is likely going to be a shortage of meat, perhaps. So yeah, and of course there's a bitter irony while all this is going on that there are farmers throwing away food because they can't sell it because they're in a different sort of supply chain than what serves groceries. So everyone's trying to work on that, but it does show that the supply chains, the way we get food, has been altered dramatically.
So we're talking about food, and in Michigan we can't forget about water. And so what is the situation in Flint? I know in Detroit there was a plan announced early in March that they were going to turn on all the water for those homes that they had turned off the water. But I'm hearing that there's been an issue of water actually being turned on in Detroit.
That's correct. As just to give background, I mean, one of the most embarrassing issues for the city in the past couple of years, even as we've had this narrative of a comeback, is that the city has turned off a lot of water access to homes and other places because of lack of payment. And so at one point, I think it was like the United Nations called it a crime against humanity or something like that. And so it's always been a complicated, much more complicated than one would think to just turn water back on. It has to do with the number of places that are now vacant. And so water is still turned on and perhaps somebody lives there. People who simply can't afford the water because they've gotten behind, and so they turned the water off. But you're right, the city announced that it was for $25, you can get your water turned on. And for another $25, you can get repairs, and we will pay you, you can pay us later. And once again, there is just a disconnect in terms of how many people have used that service, how many people are still living without water, how many of those things are going to vacant houses. It's still a mess. Somewhere between 3,000 to 9,000 households, perhaps, are living without water now. And it's always been a complex issue to fix. Even now, when there is the effort literally to say everyone should have water, it's still not something that appears to be able to get accomplished.
Wow. Education. When they closed the schools, Detroit public schools have always been disproportionately funded compared to the schools in the suburban communities. What is this impact looking like for Detroit school children? I know there are churches and other people who have donated laptops and,
Sure.
So what are you saying?
Well, there is the estimate that up to 30% of students in Detroit come from homes where they may not have internet access or computers. And so that obviously is a big issue when you have a stay-at-home and school is closed and you're supposed to teach kids from your house. Just yesterday, the city announced an initiative with some local and corporations, as well as some foundations, to try to get computers and some type of internet access to those homes. So once again, I mean, just sort of really like the number of deaths, I mean, it does point out to the vast economic inequities as well as the racial inequities in our city. And I don't know if I would call this a positive thing, but it is something now that they're addressing. I mean, the fact that the corporations are now going to give 3,000 laptops to homes is a good thing. And the fact that we're once again dealing with the water, the city finally agrees with the activists and saying nobody should not have water. Whether those victories will last, who knows? But they're on the same page.
Well, it's interesting.
Momentarily, anyway.
Well, in some of the conversations I've had with people, I said it's like the Band-Aid has finally been pulled off of all these things. Like you're saying, it's good that now corporations are stepping in to help school children, and the pandemic has exposed the inequities in the healthcare system to the point where Governor Gretchen Whitmer is now created a task force to look into the racial disparities during the pandemic. Do you know if that has actually been started? Who's going to be selected for this panel? And how will this task force actually conduct the research?
I have not paid too much attention to that, other than the fact that I know that she announced it, and it was finally an admission that it's hitting the African-American community harder than other communities. I hope they make recommendations very quickly to address these very specific needs about testing, about laptops, about other immediate needs for the community.
I'm taking a look at the questions that have come in. This is a follow-up on the testing. The question is, why has the media not asked or demanded the Democratic, independent, and like-minded moderate Republicans to set up national testing and a tracking program in cooperation with the governors, or at least, push for, ask the question and push for a follow-up?
Boy, I don't know. Like, is the most honest answer I can give you. I mean, I'm curious to see how he would think we should do that. Is more more question to his question, or their question. That seems more like an advocacy role than I think most journalists are used to. I mean, we can certainly point to evidence that national testing is something everyone is hoping for at the state level and the city level. But I guess that deals with the question in terms of advocacy and reporting.
Well, and I guess we could, Lewis, are you there? Oh, there you are. And maybe that's questions to ask our congresspeople, what are they doing in terms of pushing for testing in their own districts and things like that.
I will say we've been focusing on, what is the holdup? I mean, why is there, a lag in terms of the nasal swabs and the other things that make the testing possible.
Mm-hmm. I wanted to ask you about, I know that Bridge is doing some partnerships with the Detroit Free Press. Outlier Media. There's a new one you mentioned with the NPR station WDET, as well as the educational nonprofit Chalkbeat. Can you talk about those partnerships and how they're working with you guys in reporting on the pandemic?
Sure. The Free Press has been very good in helping with our healthcare coverage. I mean, simply just more bodies and expertise on this case always helps. There's another outfit called Outlier Media, which is really just sort of a text-based polling almost. And they're the ones who actually gave us the heads up on the food issue, because they sort of routinely kind of ask Detroiters what's the #1 need they have right now. And then about 2 weeks ago, it was food. Suddenly became the #1 issue, as opposed to housing or safety. For the first time, getting access to food was the large #1 concern by many in the city. And so that sort of gave us a sense of how immediate the need was for people going to food banks.
Yeah. What is WDET? Do you know what their role will be in the collaboration?
Sure. We're going to share reporting reporters, I guess, and I think we're going to help each other flesh out stories. I mean, it is all very much a new world for me. You know, I worked in newspapers, which meant, you know, everyone was a competitor, but now it's much more, I think, because of the dwindling number of resources and reporters and editors to work with each other. And I'm happy to do that. It's an experiment, and you know, as you mentioned before, the outfit literally that I work with, BridgeDetroit, hasn't even officially launched. So I was supposed to be spending the next, you know, these 3 weeks just sort of figuring out what we do, but of course, you know, I'm in a pandemic. We're in a pandemic, so I, you know, literally got my laptop at home, and then you know, I got a call like, okay, can you do this? So it's been like on the fly. But you know, I'm happy to do it, because I would not be wanting sitting on the sidelines for this story.
Right, absolutely. And then with Chalkbeat, I guess you'll be working with them in terms of covering education.
Yes.
Look at issues in Detroit. Okay, all right, that's good. One of the things you kind of touched on, the feeling out state. Maybe early part of April, our Attorney General, Dana Nessel, and I'm only mentioning that she's white because of context of this question. She posted a tweet that really riled the golf community. And in the tweet she wrote, "I just can't hear about one more Black healthcare worker, police officer, or bus driver die while getting a barrage of complaints from white folks outraged because they can't go golfing." So then, you know, we had these protests, and what you saw were, you know, people with Confederate flags and guns. And then there were the more organized group that were in their cars. So can you kind of talk about what this sense is outside of Southeast Michigan and, you know?
I get it. Well, I mean, Metro Detroit is at this point, is the majority of cases. And so there are large parts of the state where, you know, there's less than a dozen cases in their county. You know, interestingly enough, Grand Rapids, which is on the west side of the state, which is much more affluent, conservative, white, they are now seeing a surge in cases for the first time since all this began, and mainly it's because of, I think, the homeless population. But you know, it is the frustration of the state being essentially shut down like so many other states, and so that is an understandable situation when you don't see the immediate impact in your community and you don't think it's going to hit you. What was interesting about that part of this debate is that how there were some who were arguing a class argument, which was strange in the sense that the people who were advocating for the shutdown were sort of liberal office workers who had the ability to work at home, and it was the working class who were really getting hit, and they're the ones those protesters were speaking for, which that just did not make sense. I mean, if you look at the African American community, I mean, again, the a wide range of people within that community, and in Metro Detroit are getting hit. So to say that it's somehow some sort of office worker elites who can ride out this wave at the expense of the working class is not what's happening in reality in terms of the number of people and the kind of people being impacted. So in terms of the protests, yeah, I mean, it was, once again, social media. It was a very pro-Trump group that promoted that, very pro-gun group that promoted that. But, I mean, so that sentiment is there. And as a result, I mean, of all this debate, of course, I mean, the governor is now trying to roll out, I think, sort of a regional-based reopening of various parts of the economy.
Okay. We'll just kind of take a shift. One of the questions, going back, you were talking about the sensitive conversations in your newsroom. Can you talk about or give us a sense of what those conversations look like? What advice would you give other journalists who want to have those conversations in their newsrooms and they're finding it difficult, especially now that everyone is not in the same space?
Sure.
We're doing it
well,
on.
I mean, in terms of the way it's happening now, of course, because we're all working, out of our homes, it's literally happening through Slack, the sort of virtual immediate exchange we're having with reporters. But the way it usually works out is that literally we have a meeting in the morning, and we talk about ideas, and then it is with both editors and writers, and we sort of literally say, what do the numbers say today? What's new? And then we sort of just, it literally is a back and forth, one line or two line. What are we saying? What can we say? Are we sure that's in the right context? Those are the questions we keep asking ourselves of like, how should we couch that? What is there something missing in that raw data that perhaps is not telling something? And so it's always just that daily balance, that ongoing balance, conversation of how to do it. I mean, there is no magic formula other than to stick with the facts, be very careful, understand this is a landmine of complexity in terms of race and class that always, it's always a delicate conversation, and that's the best you can do. I mean, other than truth and experience, there really is no other way to go about it.
Right. Sometimes we're finding in conversations in newsrooms that people are really hesitant to talk about race, but I guess with coronavirus and what we're seeing and how it's playing out, that it's not going to be difficult to talk about it because it's pretty clear the impact. What advice would you give someone in talking to talk about the importance of going out into neighborhoods and how to cover these sensitive conversations if they've never, or issues if they've never done it before, or they're not comfortable doing it, but they have to now because that is the story.
Oh, yeah. I mean, well, you're right. I mean, go out and talk to as many people as you can, listen to how they're describing it, and what is their sense of how it's playing out and what they're sensitive to. I think it's a very good approach. I guess I would always question sort of the hardened narrative that forms after the story becomes clear. I mean, as I mentioned before, I mean, we broke the fact that it was hitting the African American community harder. And so the result was 2 weeks, 3 weeks later, you were getting national stories. It was all just poor black people, which is not the case. And so you always got to question that kind of hardened narrative and put it in context. I mean, let the data guide you, and also talk to experts and say, what could be missing in this data? What is this showing the full picture or not? Is it something that we're not seeing? Is it simply that there's not enough testing here, that there are some other factors that we're not seeing yet? I guess would be the conversations I would have to broach how to handle it in your community.
Mhm. Okay, we have a question here. Given the economic challenges facing so many Detroiters and the clear disparities facing the community, what is the balance between advocacy and just acknowledging the reality of those disparities? Can journalists approach coverage objectively when inequity exists?
That is a good question, and I don't know the answer, to be honest with you. I mean, you know, I mentioned before that woman who knew 12 people who had died. She's a friend of mine. I mean, it's hard not to get emotionally attached to that. I mean, I love my city, and so I always question myself of how much of that is influencing the way I approach things. So it's I guess it's just to have that continuing dialogue with yourself is the only way I know how to do it. Whether I'm objective, probably not. I don't know if anyone truly is. I mean, but to me, it means I get the right with the. I have a closer way to write about this in the way the community can deal with and not be offended or something like this is not the way I'm seeing this. And that's not good for your readership if they're not connecting to the way you talk about their own community.
Mm-hmm. I think that's
that answered your question, but I mean, that is really.
No, I think that was very good. Because it's interesting, the Detroit News last week, the editor and publisher Gary Miles wrote a piece saying, you know, we are focusing on the African-American community because that is what's being impacted, right? And, you know, it's like you're saying, you're reporting what you see, you're reporting the data, but the news is just breaking right there in front of you. And I guess that was a question because so many readers, maybe outstate readers, were wondering why this attention, which is, I guess that's kind of the polarized world we live in, where people, why we cover that. But I think, like you're saying, you know, it is your town. It's become my adopted hometown, but it's the news, you know, and it's the news right in front of us that's impacting us. And at the same time, you know, you're being as objective as you can, but you also know the benefit of being a Detroiter and being a person of color. You understand those stories that don't always get told. So in that vein, talk about the diversity of the staff. I know with BridgeDetroit, you guys have really just got started, but in terms of Bridge Magazine, what is the composition of men, women, racial makeup?
Oh, in terms of Bridge Magazine, let's see, there are maybe, there are maybe 10, let's say 10 full-time staffers. And I would say it's 50-50 women and men. There is one African-American editor, but most of the rest, I believe, is Caucasian. Well, I'm on the staff technically, and so is Stephen Henderson, the man who won a Pulitzer for the Free Press several years ago. So I guess that means that they have one Latino and one at least one African American. But I'm very happy to say that BridgeDetroit, which I will be one of how many reporters? 4 or 5 reporters and one managing editor, as well as Stephen Henderson, who was kind of, let's call him the publisher, just for sake. They all live in Detroit. They all know Detroit pretty well. And it is an honor and a joy to be in a staff of media that looks like Detroit.
Mm-hmm.
It's very cool. I'm very much looking forward to get it going.
That's great.
So, yeah.
Well, that's what we've been looking for, right? A news organization that reflects the community in which they report. Are there any other tips you would like to offer our guests joining in today for the call on?
Just remember, it's an ongoing, constant conversation to cover these things, and you should never feel that comfortable like you have it 100% right. Because it is really a moving target always, and there's someone always going to be pissed off at you when you write about these things, and it's not in context whether you should demand more things for national testing, or you are skewering one way or the other. But I mean, just know that it's something you have to be vigilant on and have lots of conversations with, and always ask yourself if it's the accurate, best way to do it.
Looking at just across the country, are there any places that could be similar demographically to Detroit, but aren't being hit as hard as Detroit? Have you seen that anywhere?
Oh, that's a good question. I don't know. Last week I read a very good piece by the Brookings Institution, the think tank in DC, who they made the connection between Rust Belt cities such as Milwaukee, Chicago, I think perhaps St. Louis and Detroit, and how it really underscored the level of Black communities, traditionally how they've been segregated in Rust Belt cities, and how they're having similar problems. Cleveland, Cleveland is a Rust Belt city, but I don't think the African American community is as large as in many of those other cities I just mentioned. And they are doing quite well, I think. Ohio has gotten praise for doing things early, and so the curve seems to have been flattened already, I guess. So that's about all I can think of. Yeah. So, but no, I don't know of any city very Detroit-like that is not been hit hard.
Okay. Okay. Good. If anyone has any more questions before we wrap up, I think we're doing pretty well. We've got 6 more minutes of time.
Felicia, I had a quick question.
Sure.
And Louis, thank you so much for this. This has been fantastic. I
Sure.
just wonder, one of the things that stood out to me in looking at how the work of the Maynard Institute is to advocate for diversity in newsrooms and in the portrayals of diverse communities. And I wonder, looking ahead after this pandemic, how do you think the coverage of these topics, such as race, such as class and gender and so forth, may be impacted going forward? I wonder if this is a watershed moment for the industry writ large, and how that may manifest itself in your work.
Oh yeah, I think. Well, as you know, I mean, I can think more of the newspaper. I can speak more of the newspaper industry than other media. But as you know, I mean, the newspaper industry is going through yet another financial crisis because of all of this at a time when its readership is way up. I mean, when I was still at the Detroit News when this just was starting to hit in early March, and our readership was triple the amount it usually is. And at BridgeDetroit, our readership has gone through the roof in terms of the number of people reading our stuff. But I think what might happen is what we're doing now, and other is more collaboration. I do think there will be, we need more voices in the community, people more connected to the community, whether it's the African American or Asian American or Latino. And so I do think we will see more collaborations with smaller nonprofit groups. Bridge is one of many nonprofit journalism outfits that have sprung up throughout the nation and other smaller groups. And I do think you will see more collaborations with those groups with larger newspapers to help fill the gap.
Mm-hmm. Yeah. What do you think about the role that these larger chains play in the ecosystem? I mean, one of the things that stands out to me is that those large chains that have been around and have played an important role in journalism for so long, at the same time, one could argue that with their acquisition on the part of hedge funds and even sort of the push to maintain profitability through cutting and not thinking about how to grow in ways that are innovative. And some argue that there's been real damage done, particularly at the local level, by these large chains. And there's been even some writings that have happened since this occurred that, yes, while readership has gone up, revenue has cratered even more. And should they remain, right? Should they go by way of the pterodactyl, given the lack of leadership that has led, some argue, for them to be in the positions that they have been for so long. So I'm just curious as to what your thoughts are about, and I don't want to put you on the spot, I know, but I am interested in what value you think those chains bring to community, and do you think that the innovation this collaboration and outfits like Outlier and others that are playing such an important role in Detroit, is that the way of the future now as chains fall away and this notion of profitability journalism, maybe it should be viewed as something more like healthcare, right? More something, these sort of social determinants of health and the need for things to be not about profit, but about in service of community. So I'm just curious as to what you think about all of that.
Oh, yeah. Well, I mean, you're right. I mean, there are some large newspaper chains that are owned by groups of hedge funds that it's hard to see if they have any interest in journalism at all. Whether they should die immediately, I don't know. I mean, the immediate impact would be that we do lose a lot of talented journalists who are still fighting to keep it going despite all of that. And so I do like to see more outfits like mine and Chalkbeat and others, nonprofits, to replace that. But we're not at the level to if we get rid of mainstream newspapers right at this moment, that people will jump to other avenues, and we have the resources even now with a battered newspaper. I mean, the truth is, I mean, I think the Detroit News, I mean, is doing a pretty good job, and they still have more people than us, even though it's they're taking furloughs and things like that. I mean, they're still full of people who have experience. So they produce really good stories every day despite what's going on. So I don't want to see a sudden loss. A more of a gradual change is what's already happening. Whether that pace will pick it up, it probably will, just because they are now such a much deeper financial hole.
Right. Thank you.
Sure.
Well, it looks like we're on break at 2 o'clock. Thank you, Louis, so much for sharing an hour of your time with us and talking about your coverage. We appreciate it very much. Thank you, everyone, for spending your hour with us today. And on behalf of our Maynard co-directors, Evelyn Sue, Martin Reynolds, and the staff, thank you for joining us today. We hope that you will share the recording with your networks, as Ava mentioned, and have a great day and stay safe.
Thank you, Felicia. Thank you, Louis.
Thank you, Louis.
Thank you.
Thank you so much.
All righty.